My name is Brian Kwame. I'm a certified registered nurse anesthetist, and I do pain management as well as anesthesia at Brookings Health System. I grew up in Pipestone, Minnesota. I went to South Dakota State University for my undergrad, and then I went to St. Mary's University of Minnesota for my anesthesia training. I then went to the University of South Florida for my advanced pain management fellowship, and that is what brought me into pain management at Brookings Health System. Pain is an unpleasant emotional or sensory experience that can be different from each patient to patient. Here you can describe it as throbbing, aching, shooting, stabbing, and it really is different from patient to patient. And we see that, and it could be in pain management as well as in the OR for different surgeries or especially on the labor and delivery room as well. Pain impacts people's lives because it can be debilitating and it can affect how they go through their day-to-day struggles and how they live their lives. It's also a different sensory and emotional experience from each patient to patient. No, you should not ignore pain because pain is the body's way of telling you that something is wrong. If you do have pain, you can either see your primary care provider or potentially come and see us as well. In pain management, we treat neck pain, low back pain, axial spine pain, which is essentially the whole spine, sacroiliac joint pain, muscle pain, non-operative joint pain that maybe you aren't qualified for surgery or don't want to have surgery. Those are the most common things that we treat in our clinic. Each person's pain is different, but we will set up a tailored plan for that patient so we can treat and manage that pain. Some of the most common procedures that we perform are epidurals of the neck and low back, as well as sacroiliac joint injections, trigger point injections, and joint injections. I also do radiofrequency ablation of the spine, which includes the neck and low back. And those are some of the most common procedures that we do in our clinic. Not everyone who sees us at Brookings Health System is going to receive an injection or an interventional pain management procedure. Typically, we need them to go and attempt conservative measures, which can include medications or therapy, prior to doing anything like injections or interventional pain. It's been proven that the sooner that we do the injections and the sooner that we do the imaging, they will then are more likely to receive surgery. And our goal with interventional pain and pain management in general is to keep patients off of the operating table. If someone can go to physical therapy and do 6 weeks of therapy and not need anything from us besides that, I think that's a win for everybody. Once they've gone through that process and they have attempted those therapies and medications and they're still having pain, then we will typically do some sort of injection. That being said, sometimes when the patient does come see us at the clinic, they've already been through that and attempted physical therapy and chiropractic care or any other modalities that they deem necessary, and we will actually order an injection that same day. Patients are nervous. I always say, if you're not nervous, you're not ready. Is kind of what I like to tell patients. I also tell my son that when he's going to play a game, okay? Being nervous is part of life. However, it's our job to make those patients feel comfortable, talk them through it. We use lidocaine, which is a numbing medication to help prevent some of that or a lot of that discomfort. Doing interventional pain management procedures, it isn't zero pain, it will be a little bit of discomfort, but the goal of the intervention is to get them on with their daily lives and so that they can move on and enjoy their life. The goal of the pain management clinic is for patients not to be on long-term narcotics or other medications. Our goal is to get patients off of those medications. Narcotics are not good for long-term, as well as the addiction properties that come with them. And it has been proven that it does not actually work for back pain, especially chronically. And so what we can do with interventional pain is hopefully treat that pain so that they don't have to use narcotics. However, narcotics sometimes need to be used for short-term purposes for those few weeks while the patient is in severe pain. Patients can come see me through a variety of ways, but typically we need a referral. You can contact your primary care provider other healthcare professional, chiropractor, and they can send a referral to us. Sometimes that can be done through the computer if they're part of the Brookings Health system or a Vera system. We also have a referral sheet that their providers will send to us and fax to us, and we'll get you scheduled in the clinic. At Brookings Health System, we take care of our coworkers, our neighbors, our friends, and our family, and that's what makes Brookings Health System so special.